Hi, this video might look a little bit different than some of the content we've been doing lately, and that's because I wanted to introduce you a little more closely to some of the techniques and interventions we use when we are working to address trauma. So, G-TEP, or Group Traumatic Episode Protocol, is a structured trauma-informed group intervention that is based from EMDR therapy. And it was developed with the intention to be able to support a larger number of people in a single setting in the aftermath of a traumatic event or experience in a safe and supported way. So, who is G-TEP for? It's offered in workplaces sometimes when people have experienced a common traumatic event. It might also be used in situations where there's been mass devastation, like a natural event like a hurricane or a tornado. It could be used in the aftermath of a public or a community catastrophe, like a shooting or a major event or accident. And it really is not intended to replace individual therapy, but it is meant to serve as a mechanism that can get intervention and support to a large number of people fairly quickly so that that processing part can begin before the trauma has time to really set into their brain and their body and their identity. So, one of the most important things that I like to highlight when I'm talking to anyone about G-TEP is that it doesn't require the sharing of your story. When we usually think about group therapy or group offerings, peer support, critical incident stress management, we often come up with the image of a group of people sitting around and talking about what they've experienced, talk about what they're noticing, talk about what they're feeling. And I don't want to diminish that there is value in sharing, feel supported, understanding that other people are also struggling. But what some research has shown is that the act of being in a group with other people who are also traumatized and sharing details of what they witnessed can inadvertently add new trauma. So if I'm sitting in a group and I've had an experience and someone else was also present and starts talking about what they experienced, but they saw something completely different that I didn't see, I might be inadvertently adding some of their trauma into my own trauma story. So while there's value to being together as a group, supporting, listening, and sharing, what I like about using an intervention like G-TEP is everybody can work on the pieces that they need to work on for themselves. So while G-TEP is offered in a group, we still have that flexibility to be able to help individuals focus on what they need to for their own healing and recovery without being exposed to the traumatic materials that other people might be sharing. So G-TEP does work with a worksheet. So that helps us to keep it structured. As facilitators, we guide the group through working through every phase of the worksheet. And each part of the worksheet kind of provides a different value. Now, as a participant, or if you're an employer or somebody who's looking to organize a G-TEP session, you don't have to understand necessarily what we're doing and why we're doing. That's the role of the facilitators, just like in therapy. We understand the mechanics about why we do what we're doing. Our job is to guide, and the participant's role is just to be present and to, feel safe and to feel supported and understand that we do have a structure to hold this trauma processing in place. Typically, when we do a G-TEP session, we would have two therapist facilitators, and that's so one facilitator can lead while the other facilitator can provide support. If somebody is struggling or needs just a little more space, a little more maybe time away from the group, the acknowledgement is that everybody processes things different, everybody is impacted differently, and I think that's also what G-TEP can offer is an opportunity for a group of people to come together and receive support and intervention while also acknowledging the individuality of everybody who experiences something. It's not always the same. We do use bilateral tapping. That's something that we use in EMDR therapy. We use eye movements, usually in person sessions. But in a group setting, we can't obviously do eye movements with everybody. So we invite tapping back and forth on the worksheet. And there are some opportunities even to do butterfly taps. And the reason why tapping is important is because it kind of offers a couple of purposes. One is when we're tapping on our bodies, we're connecting, we're feeling physical sensation. It helps us to orientate to our physical space, in our body and in the world. And it also just allows us to kind of feel that comforted connection of, I'm here, I'm noticing, I'm processing. It's almost offering a little distraction at the same time that we're focusing on something that might be upsetting or disturbing. So it's kind of like being held at the same time we're working through something that's really difficult. So as facilitators, we teach people how to do that tapping and invite tapping at various aspects of the intervention. Um, One thing that we often do, and sometimes people have questions about, is we usually will ask participants to complete questionnaires before the session. These questionnaires ask questions about stress, anxiety, coping, trauma symptoms. And we also usually ask if it's a work related situation, the level of stress, burnout, compassion satisfaction, compassion fatigue. These are just snapshots. They're not meant to be diagnostic or evaluating anybody. It's really just about, is this person, okay? Or does this person possibly require more intervention? Maybe individual therapy would be more appropriate because they're really having some heightened struggles. And we just want to make sure we're not re traumatizing anybody in the process either. So that's why we ask for questionnaires before we go into a group setting, because unlike individual therapy, where as a therapist, I usually will have, an hour of intake, getting to know a person, getting to know their strengths, getting to know their history. Coming into a group situation with so many individuals, we don't always have that time or opportunity to get to know everybody. So we just kind of want to have a little snapshot so we can see how everybody looks like they're doing before we come into the group. And then we'll usually ask to repeat those questionnaires after the session, usually a week or two later, after people have had some time to process the event in the G-TEP session. We'll send those same questionnaires again. It kind of has a twofold purpose. One is just to see, did people get some benefit? Are the numbers or the scores reflecting that there is improvement in how they're managing anxiety, stress, trauma symptoms? And it's also evaluative for us. It's nice to have a measure that can say this is a beneficial intervention. This was helpful. Or sometimes if the scores didn't change all that much, or it looks like people are still struggling, it might give us the opportunity to say this group could really benefit from a second session. So we don't always know when we're going into it. We start with one session. Sometimes the second session might be required, but it's really just about offering the support to the individuals and the group and making sure that we have some measures in place to protect and support everybody. So I was just going to hop through a couple of commonly asked questions because these are things that many people might have on their mind if they've been invited to participate in a G-TEP session. One is, do I have to speak in the group? I've already covered this. There is never any obligation or expectation to verbally share your experience. The only times that the group are invited to share information is when we're doing positive resourcing, identifying strengths, successes. There's opportunities in our G-TEP model to highlight what we've got to lean on, what works well for us, what are we good at, and we can share that with each other because everybody benefits from learning about each other's strengths and resources. But we never share any traumatic information. So if you're a participant, we're not going to have people talking about their individual experience about what happened to them in the group setting. What if I become emotional? I think that's a fear a lot of people have, even when they come to therapy. What if it's too much for me? What if I get upset? What if I begin to cry? First of all, emotions are part of processing. It's not abnormal that we're going to have emotional responses when we're facing things that are really difficult for us. That's also the benefit of having two facilitators. So if you need to step out of the room or you need some time to compose yourself or it's just not feeling comfortable or safe anymore, that's okay. We're willing to meet you where you're at and the facilitator can, have a one-on-one or, help you to get grounded or reoriented or if you want to come back into the session. So there's never any pressure, but it's totally okay if emotions are part of the processing process. What if I don't want to participate either in the G-TEP session or parts of the G-TEP session? It's completely voluntary. When we're working from a trauma-informed lens, you always have choice about what you want to do and what you don't want to do. So while we want you to understand part of the reason why I'm doing this video is so that people can have a good understanding of what to expect before they come into the session. There's no pressure that you have to do any or all of the session while we're together. That's going to be up to you. What if I don't remember anything or everything about the event? That's a kind of a common question in both individual therapy and in group therapy. In the aftermath of a traumatic event or experience, it's really not that uncommon that memories are fragmented, like certain parts stand out more vibrantly than others. Sometimes people will be like, I just can't really remember. I was here and then I was here, and I really don't remember anything that happened in between. So that's okay. The advantage of doing a G-TEP session is that we're going to work with whatever comes up as distressing. If you can't remember something, that may mean that part of the memory already got pruned or released, and it's not causing the upset or distress. So we're going to focus on whatever comes up. So it's totally okay if you don't remember everything about this particular experience. Um, Sometimes people say, is this group therapy? It is a form of group therapy, but I think where it differs is if you were going to a counseling center or a community center for a group therapy session, group therapy usually is about people holding each other accountable, offering each other support, more talking, more sharing, whereas the G-TEP session is more individually focused, but done in a group environment. So I kind of see it as individual therapy in a supportive, safe environment with others who have experienced something, either the same traumatic event or something that is similarly traumatizing for them. How long does it take? I don't recall if I already said that, but we usually plan for about 2 hours for a G-TEP session just to make sure we have enough time to kind of move through everything and get it to completion. Could be a little more, could be a little less. And I believe I already noted, sometimes we might suggest a second G-TEP session, but sometimes one is sufficient for some groups. Do I need to prepare for a G-TEP session? There is absolutely nothing you need to do. My reasoning for making this video is to provide some information and some reassurance that we're going to guide you and that you don't have to journal, you don't have to think about everything, you don't have to do anything ahead of the G-TEP session except complete your questionnaires. That's really important and helpful for us. But other than that, just being prepared to arrive, be comfortable, if you want to have a water bottle or take some tissues with you, whatever is going to make you feel safe and comfortable in that environment. And is G-TEP confidential? So, yes, it is confidential. And remember, we're not sharing any traumatic material or information about what happened. We do have a consent form that we ask people to sign ahead of the G-TEP session, which adheres to the normal expectations of it. We don't want people, walking outside of the session and talking about other people to people who weren't involved. And I do think most people respect and understand that. So while we can't guarantee, anybody's behavior, that somebody might not step outside of the room and, talk about their experience or someone else's experience, you're never sharing anything you don't want to share anyway. So we're not going to share any information. Even your questionnaires are never going to be shared with anybody else. They come to us as therapists. They don't go to the employers. They don't go to anybody else. So privacy is really important, and we take it really seriously. So we need to make sure that you feel safe to participate. So I think that's everything I wanted to touch on. I hope I covered everything. I really just wanted to talk about G-TEP, talk about the benefits of G-TEP, talk about, where and how we can use it. We really, as a team, enjoy offering G-TEP sessions because we see a lot of value in an intervention that can be done reasonably affordably, reasonably quickly, and can have a meaningful impact on many people's ability to move through an experience without having that trauma get stuck in their body, because that's when most of us are going to struggle, is if we've experienced something and we didn't get a chance to flush it out, to work it out, to get it out of our bodies. So I'm really excited about the G-TEP sessions we've done and the opportunity to continue to do those. Thank you.